The Government of Mongolia and the Governor's Office of Holskolth IMAG, United Nations Children's Fund presents the Child-Friendly Community Program.
I am delighted to share a few introductory remarks.
2013 to 50 in 2014. A year ago, in 2014, we had one child death, and a year later, in 2015, we have no case of childhood mortality. There is an outcome of the project. This is our success.
Holskolth IMAG, with United Nations Children's Fund support, is providing early essential newborn care according to the standard requirements and has scaled up the kangaroo care method since 2013 in order to reduce newborn deaths and to promote maternal and child health. Kangaroo care method has been shown to strengthen the bond between mother and a child and to prevent maternal bleeding and childhood infection. A potentially harmful practice of bathing a newborn baby immediately after the birth has been replaced with a practice of drying the baby and placing the baby on the mother's bare chest to practice skin-to-skin contact in the first 2 to 90 minutes after birth. It has also been shown that clamping and cutting the umbilical cord after visible pulsing stops helps prevent childhood anemia. Skin-to-skin contact allows maternal skin bacteria to prevent newborn infection and reduces newborn stress by allowing it to feel maternal heartbeats and bowel movements. Such soothing promotes breastfeeding and sleep. Breastfeeding builds up the child's immunity. Provisions of early essential newborn care in the General Hospital of Holskolth IMAG are helping to steadily reduce newborn mortality.
We are working to improve early essential newborn care since 2014. We have established teams in all health facilities and promoting teamwork. These teams identify challenges in improving early newborn care at a given health facility, develop plans for improving the care, and implement the plans. As a result, we have first of all taken measures to supply health facilities with soft, absorbable baby wipes. Second, every measure is taken to keep baby wipes warm at all times. And third, the ambient temperature at the delivery ward is kept at 28 or more degrees Celsius. In other words, the issue of heat loss has been resolved. In addition, we practice skin-to-skin contact. All obstetricians and health managers have been trained in order to make this practice routine.
Not long ago, maternal and child health and other social services were not equitably accessible. Population health literacy was poor, information access was restricted, and childhood mortality was high in Holskolth IMAG due to the lack of coordination between public administration and service organizations. Therefore, the Reaching Every Stone and Bog strategy, as well as the Communication for Development strategy, have been implemented, and early essential newborn care has been introduced since 2012.
In terms of early essential newborn care, the delivery ward of our provincial general hospital has introduced a comprehensive package of very simple yet essential services effective in reducing newborn mortality. These services have been successfully relocated in our hospital, and as a result, newborn mortality is declining. Second, we are implementing the Reaching Every Sum strategy in 17 SUMs and 2 family health centers. Third is the Communication for Development strategy. United Nations Children's Fund has launched a major regional policy which has been implemented widely. It has been proven that very simple practices, if mastered by parents, can reduce childhood morbidity and mortality. Regional strategy based on this evidence served as a basis for us to develop a Communication for Development strategy on maternal and child health for our IMAG. The strategy has been approved to be implemented until 2017. It will contribute to improving parental knowledge and attitudes regarding timely health care seeking and disease prevention. In SOMS, we already witness reduction in childhood morbidity, hospital admissions, and emergency calls. We believe this is a result of equitable provision of low-cost, high-impact preventive services for the benefit of the many.
The Child-Friendly Community Initiative in Hulskolth IMAG clearly demonstrates that geographical remoteness is no excuse for service inaccessibility. The parents and healthcare workers should join their forces in the quest for maternal and child health, and that shared development is possible through the expansion of knowledge. Participation initiatives and joint efforts remove inequities in public service provisions and lead to reductions in maternal and child mortality.